Good afternoon. Thank you for joining me today. My name is Stephanie Steiner, and I'm excited to be presenting this patient case study narrative. To start, I'm going to briefly introduce my patient. I will be referring to her by her initials, which are ER. She is a 69-year-old Caucasian female and currently lives with her husband in a small town here in Alabama. She is a retired school teacher and began hemodialysis in October of 2023. She has no immediate family in the area, and unfortunately her and her husband had a son that passed away a few years ago. She does not have an extensive medical history. Prior to the diagnosis of CKD, she had uncontrolled hypertension and a history of leukemia. Prior to her admission, prior to her diagnosis of CKD, she was admitted to the hospital due to the sudden inability to urinate, which led to her diagnosis of end-stage renal disease. Her current medications include a renal vitamin and furosemide, which is a loop diuretic to help regulate that high blood pressure. So just a little background on CKD. Chronic kidney disease is characterized by a gradual decline in kidney function. We see this happen in stages based on severity. So from stage 1 to stage 5. And that's diagnosed based on the glomerular filtration rate. So when CKD occurs, we see loss in those vital functions of the kidneys, such as blood pressure regulation, electrolyte balance, and filtering waste from the blood. The symptoms often include fatigue, decreased urine output, edema, and trouble concentrating or confusion. According to the CDC, it affects approximately 35.5 million Americans. So moving on, I'm going to briefly discuss the nutrition care process. That involves assessment, diagnosis, intervention, monitoring, and evaluation. This structured approach ensures a comprehensive understanding of our patient and guides our decision-making process. So looking at that first step of the nutrition care process, nutrition assessment, her anthropometric data shows that she has a height of 63 inches, she weighs 187 pounds, and has a BMI of 33.1. The biochemical data, so recent labs indicate corrected calcium of 8.7, phosphorus of 4.2, potassium of 4.5, PTH of 484, and the only parameter that shows abnormal at the moment is her albumin, which is 3.2, which is lower than the 4.0 that we would like to see, which this could be due to the fact that she's had a decrease in appetite and in conjunction with the fact that she was recently hospitalized. The nutrition-focused physical exam showed no immediate concerns. There were no signs of muscle wasting or edema present. Looking at the patient's diet history, according to the patient, prior to hospitalization, she ate 3 meals a day, didn't snack very often. Her diet did consist of a high amount of processed foods, low fruits and vegetables, and that was mainly because she claimed that that was just easier for her to prepare versus cooking meals from scratch. Looking at her estimated needs, so using her standard body weight, the patient needs 1,950 to 2,275 kcals, 78 grams of protein, 1,200 milliliters of fluid, 2 grams of sodium, and 2.5 grams of potassium. So the next step of the nutrition care process is nutrition diagnosis. And for the patient today, her diagnosis is increased nutrient needs related to hemodialysis and stage 5 kidney disease, as evidenced by poor oral intake, loss of 6 to 8 grams of protein per dialysis session, and albumin levels of 3.2 grams per deciliter. Now moving on to nutrition intervention, I recommended that the patient eat smaller, more frequent meals throughout the day to try to increase her calories. In addition, I recommended that she try to consume more protein at meals and even incorporate an oral supplement at home. Now, nutrition monitoring and evaluation. To monitor her albumin levels, weekly labs would be drawn until the patient meets that minimum of 4.0 grams per deciliter. And after that, we would continue to check labs weekly times 3 just to make sure that that level stays where it should be. In addition, just routinely checking in with the patient, seeing how she's doing, making sure her appetite is increasing and adjusting from there. Since starting dialysis, she does seem to be in better spirits and is adjusting well to the expectations that come with chronic kidney disease.